So in Ohio, are there things that you guys can do specifically that maybe you know your legislation has allowed you guys to kind of advance your profession? There's really a lot of variances between different states and opportunities for pharmacists to serve their patients. So what have you been able to find that you can do specifically in Ohio that you're really excited about?
Yeah, so that's a great question, and very much what we're looking forward to kind of diving into as our next thing. But provider status through the Department of Medicaid, allowing us to bill on the medical side for patient visits. So we're definitely looking forward to getting that started, hopefully in our pharmacy. I think one potential barrier, there's probably a couple barriers here, but the big one is probably collaborative practice agreements, getting those in place to be able to see the patients, then bill for them. That's a requirement within the state of Ohio that we have that collaborative practice in place. So I think as we kind of work through the next couple months of getting started with our cohort 3 Flip the Pharmacy group, that's going to be very much our focus of getting pharmacies paid and looking at, this is an opportunity that any pharmacy in Ohio could potentially pursue, trying to figure out how do we implement that in a bite-sized way like we have with some of these other services, and drawing that out with, the support of the Ohio Pharmacists Association has done a tremendous amount of work on provider status. And, we have pharmacies in the network that are currently, working through that process. So relying on their expertise and those that, have been working on it from day one, and hopefully seeing a lot of growth in that area across Ohio community pharmacies.
Yeah, for sure. So do you think that like collaborative practice agreements there, I mean, have you guys had collaborative practice agreements in place to some degree before? Or like how limited is the scope of those collaborative practice agreements moving forward?
So we have never had one in place at our pharmacy. So, but typically it's like per patient, per provider. So it can be quite cumbersome. So, if we had a collaborative practice and you were my patient, I would need to have one specific for you with your provider. So you can imagine, as you work with a lot of providers and patients that see various providers, it could get kind of tricky, especially if we're working in the realm of one type of insurance, and pursuing that. We would need to figure out, with all the different MCOs that exist, managed care organizations in the state of Ohio, I think our approach is going to be figure out which MCO is the most popular in our area, get signed up as a provider with them, run a report of my patients, see what our overlapping physicians are, and then try to approach the one that we share the most patients with, or leveraging local relationships to get those CPA set up. So it's going to be a challenge, I think, but one we're up for, I guess.
In that small town setting where you only have a couple of providers, I can see where, this could be extremely beneficial, especially during like flu season. But what other services are you guys looking at with that collaborative practice agreement? Are you going to be looking for like annual wellness visits, or where's that heading?
So I think it'll be very much pharmacy dependent. So we've talked about it a little bit within our leadership group, and just how different our pharmacies are from location to location. And so I mentioned earlier that we have a resident who splits his time between my pharmacy and then also the Ohio Northern University pharmacy. And they actually have a mobile clinic that goes out to rural areas. And so we've been talking a lot about, what their landscape looks like versus our landscape, and their focus may end up being more like behavioral health or those sorts of things, where mine may just be, we focus on hypertension, diabetes, and hyperlipidemia to start. So, it really could vary based off of the population that you're working with. But I think for us at my pharmacy, we'll probably very much look at what kind of, baseline diabetes, hypertension, hyperlipidemia is what we're seeing most of the time. So it seems like a very logical place to start. And likely those are the patients that are, requiring more care, have a lot of comorbidities that, hopefully we can assist and, give those providers some more time, because they're very busy too, and free them up a little bit to do some other things.
Yeah, and a lot of those are such like leading indicators of the really expensive problems in healthcare that, that general practitioner may see the patient once or twice a year, when really is a lot of those things, that monthly coaching with that appointment-based model is what's really going to have such a strong impact. It just makes sense that, that healthcare professional with that monthly touch point, that close communication and relationship is really positioned to have the most benefit.
Yeah. And to your point, I think that, going forward, kind of one of the next things I'd like to look at is chronic care management and annual wellness reviews, and kind of looking in the Medicare space a little bit more to grow beyond that initial, and who knows what will happen with what we're legislated to be able to do. But for starting with the Medicaid population in Ohio, and see where we can grow from there.
Thanks for listening to this clip from Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.